So good afternoon. It is 1 p.m. Welcome to the Health and Government Operations Committee. This is Thursday, March 28th at 1 p.m. and I am your chair, Jocelyn Peña-Melnick. To my left is my vice chair, Vice Chair Collison. And we're going to start today. The bill order may change, so please be flexible. And I want to thank in advance everyone that has to wait for their bill hearings to be called. You're going to see that we're going to go really fast. It does not mean, for those of you that are watching at home, that we do not care about the bills or are not paying enough attention to it. In most instances, we have seen these bills already. They're identical, a lot of them, and we have already heard the hearing, assigned them to subcommittee, worked them out, brought them to the committee, voted, went to the House, and now they're in the Senate. So we actually do pay attention to it and study them. A lot of my committee members are in the Senate presenting their bills. They do have access to this hearing, and they also have the files, which they study as well. So with that being said, I'm going to call the following senators. I'm going to start first with Senate Bill 614, Senator Chair Vital, who's the chair of the Finance Committee, and the bill is Maryland Medical Assistance Program and Health Insurance Coverage for prosthesis, so everybody can move act. Good afternoon, Chair. How are you?
Good afternoon, Chair. Thank you. Trying to get in the chair. So I realize I'm here and my vice chair's here, so I don't know who's got the kids.
I love that.
So thank you, Chair and Vice Chair and committee members that are here, because a lot of them are in my committee right now. And thank you to my cross-file Delegate Martinez. So we've really have worked hard on Senate Bill 614. As you know, it's also referred to as So Everybody Can Move, because it's really an attempt to get people that have limb loss for whatever reason, maybe from birth or being amputated, that it will give them opportunity to participate in different athletic or different sports. So, you know, sometimes they want to run or lift or ski or dance, and they can't do that with just the typical standard prosthetic. We've worked really hard on this in the Senate. I think, you know, we've kind of taken the lead on this bill.
Yes, and thank you.
Lead, but we've worked with Patrick Carlson, my analyst, has worked with Dr. Moran from Medicare and with the commercial carriers. And so ultimately what we did is took out orthotics. So now it's just really about prosthesis, and we're asking the MHCC to study the orthotic piece in the interim. I was a little late last year asking them to do the study, and I wasn't a chair yet, so they didn't have time to do my study. But hopefully, you'll see that the fiscal note has been just so significantly reduced. We took out certain codes. We've limited to one per year. We worked with the commercial carriers, which have been very supportive. And so I'll just ask that with all the amendments, if you will please consider passing Senate Bill 614, which means so much to the community that advocates for the bill.
Thank you, Chair Vital, and thank you for your leadership and working this bill out, because you've done, the brunt of the work, and we're so grateful. Regarding the fiscal note, what is it now? Is it 0.8 million? Because we get federal match?
It's down to 1.373 million in state funds. It's because of the match, the fiscal note is 3.383, but because of the match, it's 1.373. Think about too the long-term effects for people that maybe won't have heart disease or diabetes or obesity because they're able to move and exercise. So I think that's a benefit that we don't really include in the fiscal note. And it was taking out a lot of the L codes too that helped to reduce that number.
So we have a new revised one that has it at the net effect 0.8, which is
okay.
It's even better.
I like that even better.
Yeah,
I haven't seen that yet.
I wanted to. This is for 2025 is 0.8. For
Okay.
2026 is 1.7.
Okay.
And it increases slightly as you go up, not by much after that. But for the first year is 0.8.
Thank you. I did not see that fiscal note as of yesterday, so sorry.
Which is great.
That.
No, we just got it. So thank you. And thank you for doing that work. Because of your work, you were able to reduce it significantly. So
Yes.
we really are very grateful.
Thank
Are
you.
there any questions? Delegate Martinez.
just wanted to thank the chair for her work on this with my office. And just for the folks that are watching, we were able to reduce it from 15 million to 800,000. And so we're going to do some really good work. Thank you.
Yes, we are. Thank you again, Delegate Martinez.
Any other questions for the chairwoman? Seeing none, thank you, Chair Vital. I
Thank
know
you,
your
Chair.
committee awaits you. Thank you for being with us. We really appreciate you. Have a blessed day.
Thank you.
Thank you. This actually concludes the bill hearing on Senate Bill 614. Next, we have Senate Bill 952, Senator Heddleman, Assisted Living Program, Assisted Living Referrals, Requirements and Prohibitions.
Thank you very much, Madam Chair, Madam Vice Chair, members of the committee. I'm Shelley Heddleman, Senator from District 11, and I'm pleased to be here today to talk about Senate Bill 952. I will say, and special thank you to the Vice Chair for working with us and trying to find some consensus agreement on this bill. So I've met with a number of people in the community and want to clarify what the bill does. It does a couple of really important things. One is that the assisted living referrer business is booming. It is growing. As more and more people age in this state, they are turning to small businesses and elsewhere to get help identifying communities in our districts that are appropriate and meet the needs of their older adult loved ones. So the bill does a couple of really important things. It ensures that people in these businesses maintain liability insurance, that they require their employees to have a criminal background check, that if there is an exchange of medical information, that information is held privately, and that there is a clear understanding what the terms of the services being provided are doing, that the assisted living provider is clear to the person seeking those services, and that if there is a referral, that there's a set amount of time that assisted referral agency is entitled to a fee. If you recall, the business model of this business is that a referral company is paid by the community in which the older adult is settled. It is not paid by families seeking services. And finally, that the data that is collected by the assisted living referral agency cannot be sold. We want to make sure that information that is exchanged between families who are seeking services for their loved ones is held privately and that it's not sold. The other issues have been addressed in the bill that came before this committee, about which there were some concerns, and I think they've been addressed in this amended bill. And we have some refinements that we've been talking about with the Vice Chair that will go a long way, I think, to accomplishing our goals. It's really a consumer protection bill to make sure that older adults and their families, when they enlist services, are knowing what they're getting and that their information is protected and is private, and that the small businesses in our communities also have an opportunity to do their work appropriately. So that is it. I'm happy to answer any questions if you have.
Thank you, Vice Chair.
Thank you, Madam Chair. And I want to thank you, Senator, for your work on this. You have been a real champion for the consumer in this, and I appreciate it. We had a great subcommittee meeting this morning, and our subcommittee chair is not here, so I'm going to take the liberty of saying, and we can have this discussion, but I want to put out now that we have a bill relating to privacy that's sort of moving through, but we don't know what its status is going to be. And rather than be concerned that the bill won't pass, we are considering, and I'd like you to consider, don't have to answer us now, but to pull out of that bill the language that would provide the privacy protection that we're seeking in the bill.
I'm totally comfortable with that. That's a great idea.
Give credit where credit is due to Delegate White Holland, who just brilliantly came up with that. So
Great idea.
Thank you.
Wonderful.
Mhm.
I think
Thank
that's,
you.
yeah, really terrific.
Any other questions? Seeing none, I want to thank both of you and also for meeting with, the opponents on working it out, something that works for everyone, which is really important. So thank you, Senator, for all the time you have spent, and the Vice Chair and everyone else. I see no other question. This actually concludes the bill hearing on Senate Bill 952. Next, we have the Vice Chair, Senator Klausmeyer, which is Senate Bill 791, Health Insurance Utilization Review Revisions. Vice Chair Klausmeyer, how are you?
Well, after this bill gets done, I'll be really good. It's been a long, hard.
Yes, why don't you?
ordeal.
You want to?
Yeah.
Yeah.
Okay.
Yeah. And my vice chair is gonna join you too.
Okay. Very much so. And I'm gonna keep it very, very brief, because I'm sure they've heard your side of the story.
So this is
but-
Senate Bill 791,
Yes.
Health Insurance Utilization Review Revisions. Why don't you go ahead, Madam
Okay,
Vice
good
Chair?
afternoon, Chair Penny-Mellick and Vice Chair Cullison, and members of the Health and Government Operations Committee, which used to be the Environmental Matters Committee, just so you all know. That's where I got my sea legs. So thank you for the opportunity to present Senate Bill 791. Senate Bill 791 is a cross file to House Bill 932, which has passed both in this committee and on the House floor. The two bills are almost identical, but the Senate added an amendment on the floor to add biological product use for how you say that?
Immunotherapy.
Thank you. I can't get that one out. Thank you for
You're
being here. To the reauthorization provision of the bill. Other than that one amendment, the bills are in identical posture. So thank you, and I ask for your support on Senate Bill 791. So,
And thank you for your work and for keeping your word, so which is so important, and for your hard work. I know this has been a little bit trying, this bill, and you and Vice Chair Collison have handled it really well, considering.
it has been a challenge.
Yes, considering, so thank you so much.
Okay, thank you.
Vice Chair
We're not
Collison.
done yet. We still have some things to talk
Yeah.
about. So I'm gonna
Um,
grab her for a few minutes.
Madam Chair, I want to thank Vice Chair Klausmeyer for her work and know that this was many, many hours in the making. And up until January, we had spent many, many hours together working on this bill.
How many
with-
meetings did you have?
Well, there were a total of 11 meetings of large groups, but then there were another 5 meetings with just a smaller group, including the senator and I.
16 meetings. How many emails?
Oh, I don't know if I can count that high, Madam Chair.
Many, many, many emails.
Many. And to get us to this point where we are still refining the language around that, the inclusion of the biologics and also who is included in the bill. So those are the two pieces that we are working on, but I think I'm very hopeful that in the next 48 hours, we're going to be able to come to resolution on these two issues.
Well, thank you
And
very
thank you
much
for
for
your
your work.
support.
Really appreciate it. You know, I think when this bill is done, there's definitely a need to dissect what happened and for people to realize that at least we try very hard in the General Assembly to work in a cooperation, right? And to basically keep our word, right? Around here, all you have is your word. If you don't have your word, then that's a problem. And trust. And I think some things went wrong in this bill. So I really want to thank you for your patience in working through everything. We really appreciate it because at the end of the day, it works, it helps the consumer and the people. And that is what a lot of people are forgetting here. And this bill, a lot of other states are doing a lot more than what we're about to do. In DC, you cannot refuse if it's based on cost only. It has to be medically necessary. And Care First participates in DC where that is the requirement. And in Virginia, they participate as well. And it's required for behavioral health drugs. So we're not asking for anything that other states are not doing. People in Maryland deserve this. So
Sure
thank
do.
you for working so hard. Are there any questions? Thank you so much for being with us, okay?
Thank you.
Thank
You're
you for
welcome.
your
This
time.
actually concludes the bill hearing on Senate Bill 791. Next, I saw Senator Hester. Senator Hester, Senate Bill 818, Information Technology, Artificial Intelligence, Policies and Procedures, Artificial Intelligence Governance Act of 2024. Good afternoon, Senator Hester.
Good afternoon, Madam Chair.
How are you?
I'm great. How are you?
We're doing well. Thank you for asking.
It's a pleasure to be out over here. Thank you for your consideration of Senate Bill 818. You all have heard the cross file by Delegate Jazz Lewis, and so I'm here to ask for your favorable report. Just very briefly, I want to remind you what Senate Bill 818 does at a very high level. First of all, it codifies the governor's executive order on artificial intelligence. It requires impact assessments and a state inventory.
Senator, 1 second. Patrick?
Yes.
Will you be so kind and also have a seat? Thank you. Go ahead, Senator. Okay. I don't
So-
want to forget. Go ahead.
Sorry. So just, I thought that it would be helpful to point out the differences between Senate Bill 818 and HB 1271, sponsored by Delegate Lewis. And so basically the changes that you will see in this bill compared to the one that you've already heard are, first, there is an exemption for state public higher education institutions from the AI guidelines in cases where they're using artificial intelligence for academic and research purposes. So that is the first change. Secondly, we have included a definition of rights impacting and systems impacting, and safety impacting artificial intelligence. This is in line with the OMB guidelines, and they have just come out and finalized those guidelines today. So we could, there's some slight differences in the federal definition, but it's basically intent is the same. And so I feel like we're in a good place there. The third thing that the bill does is it narrows the scope of the impact assessments and the system inventories. So it only applies to these rights impacting and safety impacting systems. And so that has resulted in a much lower fiscal note, which I'm sure that you'll all be happy to hear about. We've also slightly modified the role of the sub-cabinet and clarified some procurement applications in the bill. Finally, it removes the requirement for an interim report and instead requires a study. So we have been in conversations with Delegate Jazz Lewis about all of these changes. I think that he is up to speed on them. There will be some further amendments that he is working on, which I fully support. And I would just like to thank you personally, Madam Chair, for pulling us all together over the interim. I think it's a very strong bill developed in consultation with all of the stakeholders at your suggestion. So thank you for that. And so I'd respectfully request a favorable report on Senate Bill 818.
And thank you, Senator, for your hard work, because you put all that work and you were available for all the meetings and for being willing. So we thank you.
My
It makes
pleasure.
it easier.
My pleasure.
Next, please. You want to go? Okay.
Yeah, good afternoon, Chair Pena-Melnick, Vice Chair Collison, and members of the committee. I'll keep it short, but for the record, my name is Patrick Mulford. I'm the Chief of Staff of the Department of Information Technology. I just wanted to thank Senator Hester and the members of the House who actually worked with us in the interim on this bill, yourself included, Madam Chair. We're excited to where the bill is, but as the Senator said, we're working with Delegate Lewis on a few further amendments. A bill this size, it takes some work. So we're excited to see those amendments come through, and we would ask for a favorable report.
Thank you. And thank you for working with the sponsors and with the committee as well. And thank the secretary for us.
Will do. Thank you.
Are there any questions for this panel? Seeing none, thank you so much. We really appreciate your time and all your efforts. Is there anyone else here for this bill?
We had folks available to answer questions, but
Okay.
seeing as there are none, we're good.
No, you did well. Thank
Thank
you.
you.
So this actually concludes the bill hearing on Senate Bill 818. Have a blessed day, Senator. Thank you so much.
I have this
And-
second bill.
Oh, you have, let's see, which one do you have? You have Senate Bill 982. That's right. And this is jointly assigned between Health and Government Operations and Appropriations. It is information technology, modernization of information technology projects. Again, good afternoon, Senator. You can go ahead.
Good afternoon, Madam Chair. For the record, Senator Katie Freyhester, thank you to the members of this esteemed committee for your favorable consideration of Senate Bill 982. So this bill is actually the cross file of HB 1188, which was sponsored by Delegate Kaiser, who is my co-chair on the Joint Committee on Cyber, IT, and Biotech.
She's in the Senate right now.
Probably in my
A lot of
committee.
them are in your committees testifying.
It also includes two departmental bills, and I'm delighted to have Dewitt here with me today to speak to that. The two departmental bills were HB 227 and Senate Bill 247. And so what happened in the Senate was that Chair Feldman requested a work group, which was staffed by DLS, and we combined, we had members from the Triple E Committee, the Budget and Tax Committee, the Department of Legislative Services, Department of IT, the Treasurer's Office, Department of General Service, all really working towards this one goal of making our IT as modern and streamlined as possible. You will also know that there's a revised fiscal note, which is significantly lower. And there's also $1 million in the dedicated purpose account for the inventory of legacy systems. So broadly speaking, the bill you have before you as amended, first of all, there's a 2-pager uploaded into your floor system, which goes into all of the amendments, but the most important ones are that it renames the major IT development fund to the Information Technology Investment Fund, and it provides that 20% of this fund, of the monies appropriated, shall be set aside for these expedited projects. It then authorizes the Secretary of IT to fund major IT development projects through a revolving loan process. It requires the Secretary to establish a process to apply for agencies to apply to the funds twice a year in a competitive manner. So this takes those smaller IT projects out of the annual budget cycle and allows them to get those more rapidly. In this competitive manner, it also makes it easier for small and minority businesses to be vendors for those projects. The bill requires the department to inventory and assess the state's legacy systems. As I mentioned, that money is in this year's budget. It alters the Modernized Maryland Oversight Commission to advise on best practices and adds one member of the information technology industry. It also requires, in uncodified language, the department to develop a state modernization plan and mandates the creation of 2 positions, one to assist with the new fund, and the second to serve as a grant writer to identify and pull down all the federal money related to IT modernization that we can find. So once again, there's a detailed analysis of the changes to the bill in your testimony. I feel like we were able to bring all the stakeholders together, and the combined bill will accelerate and improve the efficiency of updating our legacy systems. For these reasons, I ask for your favorable report on SB 982 as amended, and I'm happy to answer questions.
And thank you for working with everyone. I appreciate it. Do you want to be heard on this?
I just that we do have a few amendments that
Say your name for
I'm
us,
sorry,
please.
Patrick Mulford, Chief of Staff for the Department of Information Technology.
Thank you.
We have a few amendments that we're working with the committee on, and we do really appreciate being brought to the table and working with the working group that brought the other amendments to this of this bill. But we really appreciate the time. Thank you.
All right, thank you. And thank you, Senator, for your bringing everyone together. Go ahead, Delegate Alston.
I'm sorry, I forgot to ask on the other bill with the amendments, were the universities on board after that? I'm sorry.
Yes, they were.
Okay, thank you.
Okay. Any questions? Seeing none, thank you so much for your hard work and for coming together to a compromise, okay?
Thank you very
Thank
much.
you.
Keep up
Have
the
a
great work
great
you
day.
do in this committee.
Thank you. Have a blessed day. This concludes the bill hearing on Senate Bill 982. Next, we have the fabulous Senator Kramer, Senate Bill 825, Health Facility Delegation of Inspection Authority Nursing Homes.
Good afternoon today, Madam Chair.
Nice
members
to
of the
see you
committee.
again. How are
Pleasure.
you?
I'm well, thank you. Busy day over here in the House. I've got a stack of bills. I'll be visiting economic matters.
Oh.
So if you'll have something to put on the wounds, I'd appreciate it. When I crawl out of there, assuming I still have any breath left in me and I haven't bled out. Madam Chair, For the record, Ben Kramer here to introduce Senate Bill 825, which was cross-filed with the outstanding Vice Chair's House Bill 1475. And just quickly, Madam Chair, I understand there's something in the works, but this issue was brought to my attention in the fall. And the moment I learned of it, I was just shocked. Montgomery County has had an MOU with the state to take on the responsibility of doing nursing home inspections for a decade. That MOU expired in 2021. Since that time, nursing home inspections in Montgomery County have ground to a halt. I finally, after the bill hearing we had in the Senate on this and repeatedly asked for it, received yesterday that the annual inspections that have taken place, and I believe there's 36 nursing homes in Montgomery County, in total, there was one inspection last year, there was one inspection the year before. These are the most vulnerable in our community. And Madam Chair, Maryland is ranked in a tie with the state of Kentucky for the largest backlog of nursing home inspections in our nation, tied for last place with Kentucky. The bill before you would allow for any one of the counties or the great city of Baltimore to do what Montgomery County had done for the past 10 years up until 2021. And that is say, we'll take on the responsibility just granted to us. And that would allow our nursing homes to start getting their annual inspections. But I just think that this is a horrible look for the state of Maryland, and the potential for tragedy is dramatic. And so I'm hoping that we can get the issue resolved. I can't speak for other jurisdictions in the state, but I suspect if you were to start pressing for the information, you would find your jurisdictions are in a very similar position as we are in Montgomery County, and our nursing homes are simply going without inspections. So that's the bill, Madam Chair. That's the issue. I appreciate the work that I understand you've been doing on this issue, and the great Vice Chair has been doing. So I very much appreciate and thank you for that. But I think this is just an obligation that we as legislators have to step up to the plate when we are seeing our very most vulnerable seniors being left to who knows what conditions. So thank you.
Well, thank you for your work and for caring. It's an issue that is very important, right? Because when you're in your golden years, you're very vulnerable. It's like being a child again, with all due respect in most instances. However, I always believe in this committee, and I got last year a jar of honey, that I always try the honey before the vinegar. And it's a new administration, it's a new Secretary of Health, and I have met, and your Vice Chair, who's doing a lot of the work, have met with the Secretary and with the administration, and they have promised to meet with you. I believe that there's a meeting on Monday, another meeting on Monday, and they have promised to look at the office of healthcare, OHCQ as well. I had spoken to Nailesh as well. So let's give it some time, okay? But they know that this is a priority. And we're gonna come back next year, and if we're in the same place, then the bill is gonna pass. But I believe in giving them a chance to try to fix it. And I thank you for being gracious and flexible to allow this, okay?
Thank you, Madam Chair. Like I said, I appreciate your work, and the diligent attention that the vice chair has also paid
She's working
attention
very
to.
hard. I told you she's your best
I know,
side.
I know. I don't take issue with that.
She works really hard. Are there any questions for the senator? Seeing none, Senator, thank you for
Thank you,
your
Madam
time and
Chair.
thank you for coming here and good luck. I have a lollipop if you like to take it to your next meeting.
I think I'm just gonna need some bandages, something to soak up the blood, so.
Oh, it's
Thank
a
you.
great committee. All right, take good care. Have a blessed one. This concludes the bill hearing on Senate Bill 825. Are there any senators? Oh, Senator Hershey, Senate Bill 595, Health Benefit Plans, Calculation of Cost-Sharing Contribution Requirements and Prohibitions. Good afternoon and nice to see you again.
Good afternoon. I see Senator Kramer warmed up the crowd for me. I appreciate that. Thank you very much, Madam Chair and members of the committee. For the record, Senator Steve Hershey to present Senate Bill 595. Obviously, this committee, along with Senate Finance, has tried to do as much as we can to drive down the cost of prescription drugs. There was a big bill this year that dealt with PDAB. Obviously, we're not going to see that one move forward, but certainly we are trying to find ways to see how we can best affect out-of-pocket expenses. Because at the end of the day, regardless of where the prices are, regardless of where PBMs are, regardless of where insurance companies are, what really matters is what the patients and our constituents are paying for the prescription drugs. So this bill simply ensures that copay assistance would count towards the deductibles and out-of-pocket maximums for patients. And I appreciate working with Delegate Johnson on this bill as a cross-file. I recognize that we have two very different bills right now between what the Senate passed and what the House passed. And Madam Chair, I appreciate you inviting me over 2 days ago to discuss this. I think that we can eventually get to a place where we can agree on something. We have, again, the Senate bill had taken some of the language that came from the insurers that wanted to deal with the generics. And we were fine with that. The House put some language in that dealt with notification of patients with regards to how long the copay assistant would last. We would agree with that. We have some language that just tightens it up a little bit, talks about total cost rather than maximum cost, and talks about duration rather than an expiration date. And I think Vice Chair is aware of those. So, and then I think really where the kind of the difficult part is where we are between what we are with where we are with the HSS plans and where MIA is regarding the or not HIS plan, HS, and where MIA is as far as the kind of the governing and the oversight of this. We understand from the patient groups that the language that we had in the bill, the Senate bill, was a little bit more inclusive of trying to get all the patient groups in place. So where the MIA language that we have seen in many pieces of legislation here in Maryland before, that's more focused on where that is, might end up excluding some patients from being able to participate in that. So as I said the other day, we're going to try to work on seeing, what that really is. I think it was mentioned at one time that it might only be 3 different groups of insured, but the reality is how many people are in those 3 different groups. And so we want to just see, again, the language with respect to MIA's language and make sure that we don't exclude too many people with that. And then I think, again, the beginning of the bill, we had a number of definitions in there before we got to the actual, meat of the bill and what we're trying to do. Again, we put that in as written from the patient groups to make sure that the insurers and the PBMs cannot find some loopholes that they have kind of done before. And that's how we got the accumulators, and that's how we got the out-of-pocket maximums as well too. So again, I think that there's some room that we can negotiate that as well too. And at the end of the day, again, I think we've had enough conversation. We're bringing everybody together to try to find a way to get both of these bills matched in together. Came out unanimously over, the House bill came out unanimously here, Senate bill came out unanimously there. And even though they're very different, I think the concept and what everybody wants to do is agreeable. So I think we have a little bit more work, but I am happy to address any questions. And again, Madam Chair and Vice Chair, I appreciate the opportunity to continue working with you and trying to get this across the finish line.
And thank you for, meeting with us on 2 days ago.
Yes.
Really appreciate it, and for the courtesy and your flexibility. Are there any questions? I don't see any. However, I do have concerns.
Yes.
We have 8 days left of work. Tomorrow's Friday. I don't believe we're working this Saturday. I'm not sure. Don't quote me on it because I'm not the speaker. But maybe we do. But I know for sure that we will work next weekend, that Saturday before Sine Die. We're talking about after tomorrow, 7 days. This is a consumer protection bill. And I know that with some of the things, and I know you and I discussed it in the bill that came from the Senate, we will lose the support of the carriers and MIA. I really think that it is an important bill, especially for seniors who get these coupons, right? And sometimes they go and they're not aware when they expire. It gives them a discount on their drugs. So I hope that the patient groups, if you can let them know, and if they're listening, that I believe that a half loaf is better than none, and that there's always next year, and that we can give some relief to some. And I ask respectfully that we get there, because it's 7 days, and things can fall apart next week. And I really would like to move it. So thank you so much for working with us.
And thank
Really,
you.
again, appreciate it. You've done a lot of work and know it quite well, and have really represented them really well. And I can tell you, if you're watching, that he fights really hard in my office, fought really hard. So, but at this point, I really would like to pass the bill, and preferably in the House with a couple of the tweaks that you want to put in there to make sure that we get it done. And thank you again for being flexible. I mean it, okay?
Thank you, Madam Chair. And message was heard loud and clear when we were in your office. I assure you, I lit the fire under a number of people to make sure that we could be able to come together and work together on this. And I appreciate your leadership and willingness to work on this as well, too.
Absolutely. As soon as you get it, I will make sure it's voted on and we get it on the House. I do not want to see this bill on the floor on Monday
Understand.
or Friday.
Understand.
Yeah, thank you so much. And I hope your day is blessed.
Thank you very
And
much.
you know you're
Madam Chair.
welcome here anytime.
Well, thank you. Very kind
Thank
of
you.
Thanks.
Have a
Bye-bye.
blessed day.
You too.
This actually concludes the bill hearing on 595, Senate Bill 595. Are there any senators here? Seeing none, let me start with Senate Bill 219, Senior Prescription Drug Assistance Program Sunset Extension.
Good afternoon. Hi, Madam Chair, members of the committee. It's good to be back again. Really pleased to be here on behalf of the Maryland Department of Health. For the record, Ryan Moran, Deputy Secretary of Healthcare Financing and the state's Medicaid Director. We're here to urge a favorable report on Senate Bill 219, which is the Senior Prescription Drug Assistance Program Sunset Extension. The bill would extend the date of the program from its current date that extends through from December 31st of 2024 all the way to December the 31st of 2030. And this would allow the current senior prescription drug program to continue to assist low and moderate incomes Medicare beneficiaries with their Medicare Part D costs. I just want to provide a little bit of context for those of you that may not be familiar with the program. The Senior Prescription Drug Assistance Program, which falls within the Division of Healthcare Financing, does serve as one of the most important safeguards for seniors in the state of Maryland to afford their prescription drugs. In 2022, the program served about 25,000 seniors in our state, and the program provides subsidies to help Medicare beneficiaries with low and moderate income pay their Medicare Part D premium prescription drug costs. Care First, the funding for this program, Care First is required to fund the program to earn its premium tax exemption as a nonprofit health service plan. Seniors are eligible to, are provided a premium subsidy of up to $75 per month towards their Part D premiums. We estimate as a department that approximately 87% of those enrollees, that 100% of their monthly Medicare Part D premium costs will be covered in calendar year 2024 in the program. Just a little bit of, we can provide you more in terms of jurisdiction, but Baltimore County is the highest enrollee and concentration of members, about just north of 5,000, and Baltimore City comes in second, north of just about 2,500. I also want to note that this is a partnership that we have across agencies as a program. We partner very closely with the Department of Aging and their coordinators and volunteer counselors on information regarding the program, messaging, awareness. And we, in healthcare financing, we maintain a call center and a staff of operations and website and other marketing information about to answer prospective members' questions throughout the year as they apply. So I'm happy to answer any questions that you have, but we thank you in advance for a favorable report.
Thank you so much, and thank you for always speaking up, taking my call, even when you know it probably requires work. I thank you very much, and Marie Grant is probably agreeing. Are there any questions?
She gave you a thumbs up.
Yeah,
Chair.
Vice Chair Collison.
Thank you, Madam Chair. I want
You're
to
welcome.
say thank you for taking my calls as well, no matter what day of the week it is. Talk to you on more Sundays than we want to admit.
My pleasure.
I do just want to clarify, just to make sure that, first of all, this is an excellent program. As a senior, I'm very happy to hear about it. As a senior on Medicare Part D. So we have a number of state retirees who are going to be switching into Medicare Part D on January 1st, 2025.
Yes.
Will they be eligible for this program?
Yes, they will
Thank
be.
you. Thank you very much. That's what I needed to know.
Yep, absolutely.
Okay, any other questions? Delegate Lewis.
Thank you,
ahead.
Madam Chair.
You're welcome.
Thank you, Director Moran. To follow up on the good Vice Chair's question, how does this, how, if at all, does this bill affect seniors who retired before January 2025? I have a lot of constituents who reach out with concerns about the senior prescription drug program, and I'll be honest, it's so complex. I don't know always what to tell them. Can you help?
Yeah, so maybe it might be helpful, Delegate Lewis, for us to set up some time with our program staff on this issue, and yeah, that'd be great. Yep.
You're welcome.
Happy to do that.
Any other questions? Seeing none, thank you so much for being with us today. This concludes the bill hearing on Senate Bill 219. Next, we have Senate Bill 237, State Board of Certification of Residential Child Care Program Professional Sunset Extension. Who is here for that bill? All right, come on. We do not bite. We don't bite, we don't scream. We don't do any of that. Go ahead.
Good afternoon, Madam Chair, Madam Vice Chair, committee members. Senate Bill 237 is the State Board for Certification of Residential Child Care Program Professionals Sunset Extension. I know you heard from us on a few bills last week. You're going to hear about a bunch more coming up. Where there are departmental bills that extend the sunset dates of many of our smaller health occupations boards to 2028. This was discussed in subcommittee, a few of them, so not this bill, but a few others in subcommittee today. I think the department is very open to talking with the committee about a 5-year extension across the board rather than a 3-year extension. It did sound like there were some concerns and we were very open to that. So with that, urge a favorable report and thank you for your consideration.
Thank you very much. Are there any questions for Ms. Grant regarding this bill? Seeing none, thank you very much for being with us. This actually concludes the bill hearing on Senate Bill 237. Next, we have Senate Bill 238, State Board of Dietetics Practice Sunset Extension.
Madam Chair, Madam Vice Chair, committee members, Marie Grant. This is a bill that extends the sunset date for the Board of Dietetic Practice by 3 years. Again, similar posture, would love for all of these bills to be considered in similar fashion, with one exception that we'll get to a little later. But with that, urge a favorable report and happy to continue talking to the committee about a longer extension date.
Any other questions or concerns? Any questions or concerns? Seeing none, this actually concludes our bill hearings on Senate Bill. Oh, there is. I'm sorry. You're live. Delegate Johnson.
Thank you, Madam Chair, and thank you for bringing these bills. You mentioned a 5-year extension instead of 3. Can you tell us what the benefits would be of that?
I think that it strikes the balance for the department where I think, first of all, that we proposed 3 years. I know the secretary and we didn't come to that decision lightly. It was the idea was to do 3 years to really take a good look at the operations of all the boards and make any recommendations regarding operations IT that might make sense. But that all being said, I think certainly we've heard from this committee, we've heard from the chair and vice chair that a longer extension date might be more appropriate. And so that's why I know this board in particular, and I haven't seen the testimony packet. I know in the Senate, the board itself did ask for a 10-year. So a couple of our boards did write and ask for a longer extension date. I think this is one of them, but we'd rather just handle it universally and would recommend 5 years.
Go ahead, Delegate Johnson.
As you just mentioned, IT is changing so rapidly.
Mhm.
Do you think 5 years is too long to take a look and see if we need to change?
I think that we will continue to do that look anyway, even with a 5-year extension, and we can always come back to you all earlier if we need to, but I think we can live with a 5-year extension date.
You're welcome. Any other questions? Seeing none. Thank you very much for presenting on Senate Bill, what was it,
238.
238. This concludes our bill hearing on Senate Bill 238. Let's go to Senate Bill 240, State Board of Examiners in Optometry Sunset Extension.
Madam Chair, Madam Vice Chair,
Yes.
committee members, same testimony. Thank you.
All right, any questions? Yes. This actually concludes this bill hearing, Senate Bill 240. Let's go to Senate Bill 241, State Board of Examiner Psychologist Sunset Extension.
Madam Chair, Vice Chair, committee members, Marie Grant on behalf of the Maryland Department of Health, same testimony.
All right, any questions? Seeing none, it actually concludes the bill hearing on 241, Senate Bill 242.
Madam Chair, Vice Chair, committee members, Marie Grant on behalf of the Department of Health, same testimony. Thank you.
All right, any questions on this bill, the State Board of Social Work Examiners? Seeing none, it concludes the bill hearing on Senate Bill 242, last bill of the day, Senate Bill 243, State Board of Professional Counselors and Therapists, Behavior Analyst Advisory Committee Sunset Extension.
Madam Chair, Madam Vice Chair, committee members, here's where my testimony gets switched up a little bit. Marie
Okay.
Grant on behalf of the Department of Health. Just when we were getting in a good rhythm it's important, actually, the sunset date is a little bit different for this particular bill because it is a committee, and the bill actually aligns the committee sunset date with the sunset date of the broader board, which is not part of the departmental package this year. And so we would urge a favorable report on this bill and treat it a little bit differently than the others, just because of the nature of the bill in the committee.
So because of the nature of the committee, expand a little bit on that.
So the committee is actually a committee within a different board that has a different sunset date, which is not being considered as one of this package. So the sunset dates didn't align. This would align it so that when you take a look at that board, you'll look at the committee again. as well.
Wonderful. That makes it very clear. Any questions? Vice Chair Collison.
Thank you, Madam Chair. So I'm going to go one step clearer, I think. So right now, the Board of Professional Counselors and Therapists has a sunset date of 2026. And all we're doing is aligning the committee's date to 2026 as well.
I couldn't say it better myself. Thank you, Madam Vice Chair.
Thank you.
All right, any questions? Seeing none, this concludes the bill hearing on Senate Bill 243, and it concludes the bill hearings for today. Thank you
Thank
so
you.
much. Oh, wait, I have one? Oh, Senator Guile. Okay, that is Senate Bill 795, but you're not Senator Guile. Come forward. Health occupations practice audiology definition. Almost miss her. You don't look like her.
I know
Go
it's
ahead.
a little different look than the
Yeah,
normal.
Senate Bill 795, which will be our last bill. Senator Guile.
Thank you.
Can you tell us your name?
Yes, Spencer Dixon, Legislative Director, here to present Senate Bill 795 on behalf of Senator Guile. Want to thank Delegate Martinez for sponsoring the cross-file on this bill, HB 464. The bills are in the same posture as they were amended in the same way in both chambers, and I request a favorable report.
We love the testimony. Thank you so much. Any questions for this bill that is in the same posture? Seeing none, thank you very much.
Thank
This
you.
concludes the bill hearing on Senate Bill 795. Let her know you did well. All right, now we're really done. Okay, you can bring us down.